Okay, good morning, student. Can you hear me? Am I audible?
Yes, ma'am.
Okay. So all of you, do you remember what was our last class? Anyone? What was our last topic that day? I have taught you all night yesterday. What was the last topic?
Management of renal artery aneurysm.
Okay, very good. Okay. So I think I have taught you all till renal artery aneurysm, right?
Yes, ma'am.
Okay. So A, B, C, yeah. There were the 5 types now that we have discussed the vascular condition. Now, so now we are coming to the number four number, that is atheroembolic renal disease. So we have already discussed about this, right? So what was the meaning of this atheroembolic renal disease? So what was that? Because now we are discussing the treatment now. So let's go to the flashback of all those we have already discussed. So can anyone tell me what is that? Atheroembolic renal disease? Because if you won't know the meaning, how you will try to manage it? Darshana, what is atheroembolic renal disease? Because I have already explained. Say fast, please, don't waste time. Please don't waste time. Okay, Ilasara, can you please tell me?
Yes, ma'am.
Yeah. What was the atheroembolic?
This is a renal disease that occur when a piece of plaque from the aorta or large artery break off and travel to the bloodstream. It will block the small renal artery.
Yes, very good. Okay. There was atheroembolic renal disease, right? It was when a piece of plaque, okay, that is from a larger artery, it will break off, and then all those whatever arteries that are break off, it will travel to the bloodstream. And if it travel to the bloodstream, then what will happen? It will block all the small these renal arteries, okay? So that was all about the atheroembolic renal disease, and it was mainly like common in the children or in the adult or else in this elderly. Anyone? Because nowadays this atheroembolic renal disease is becoming more common and common now. So means which mainly cause kidney problems. So it mainly affect whom? The children, the adult or else the elderly. Ilasara?
Yes, ma'am. It affects the older adults and the elderly.
Yes, older adult. That is older adult means this elderly, okay? So elderly, okay. So let us now discuss how we can manage this. So first is medical treatment, okay? Medical treatment may include medication to reduce or lower cholesterol. So like medication such as this, such kind of medication will be prescribed where cholesterol level can be lower or reduce, or else the blood pressure, because when there is, when there is the when there is blockage of the arteries and all now, that can lead to this high blood pressure and all that. That's why because of that, this you have to give medication that can mainly lower or reduce the blood pressures. And also you can treat other related conditions such as diabetes. So there are also certain medical condition, okay, certain other health issues such as this diabetes and all this, this can also be like treated. So coming to the next will be this surgical treatment. So surgical treatment may include the same thing, this one, endovascular procedure. So endovascular procedure means that angioplasty, that I have already explained that you all the meaning of angioplasty. and then always placement of the stent, that also I already explained, and then open surgical procedure to bypass the blocked renal artery. So open surgical procedure, this also I explained what is open surgical procedure. So this procedure is also mainly done, okay, to bypass the blocked renal arteries, because of that, what was that? Because in this atheroembolic renal disease, it mainly occur when this disease, it mainly occur now when a piece of plaque from a larger artery it break off, and then it travel to the bloodstream, and then it will block the small renal arteries now. So all those blockage of this renal artery, to open surgical procedure, they will try to open that particular arteries. Means they will by opening that renal artery, they will try to remove all those blockage. Okay, so this is the surgical procedure that is being done. It's almost same with all the other management. So are you clear this medical and surgical treatment of atheroembolic renal disease?
Yes, ma'am.
Ma'am.
What about others?
Yes, ma'am.
Okay. Okay, next is renal vein thrombosis. So from the name itself, okay, let me ask you all, what is renal vein thrombosis? Because we have already discussed, right? What is renal vein thrombosis? Nafishisa, can you please tell me what is renal vein thrombosis? Okay, rich person, can you please tell me? Rich person, can you hear me? Rich person, can you hear me? Yes, rich person, can you please explain? Renal vein thrombosis, I already explained.
Is a thrombotic occlusion of one or both main renal veins, resulting in acute kidney
formation
injury
of?
or chronic kidney diseases.
Okay.
Thrombotic occlusion of one or both main renal veins, resulting in acute kidney injury or chronic kidney diseases.
Okay. This person, what do you mean by
Hello?
thrombosis? Rich person, what do you mean by thrombosis?
Yes.
Okay, this person, no problem. At least you reply. Okay.
One blood clots.
Yes, very good. Yes, yes. Yeah, you are right. Okay, thrombosis means clot. Okay. Okay, so we already know now that renal vein thrombosis, it was the formation of the clot in the vein of the artery. It means in the vein of the kidney. Now there will be clot in the vein of the kidney. So whenever clot occurs, whenever there is a blood clot, okay, we prescribe this medication. So what class of medication we need to prescribe if someone have this blood clot? Yesterday only, like I have discussed. Anyone have any idea regarding this? Baboklang, do you have any idea? Shelly?
No, ma'am.
Shelly, you have any idea? Dibyajit?
No, ma'am.
Okay, Srijana, do you have any idea about this? Renal vein thrombosis. Because there will be blood clot now. So what type of medication, what class of medication that we will mainly focus on?
Ma'am, forgot.
Okay. So we have already discussed renal artery thrombosis, right? So in the renal artery thrombosis, what management did you find in the renal artery thrombosis? What type of management you will find in that renal artery thrombosis? Thrombolytic medication is being given, na? That is like this this coagulant. So all these things are being given. Okay, so let me show you. So renal thrombosis, it is mean like generally treated with anticoagulant medication, okay? Because when there is blood clot, that means clot means what? When there is coagulation of the blood, okay? When blood is being coagulated, at that time we prescribe a medication known as anticoagulant medication, because we have discussed so many. Now, when you have infection, what type of drug you need to prescribe? That is antibiotic. And when you have hypertension, what type of drug you need to prescribe? That is SCE, angiotensin converting enzyme, all those things. And when you have inflammation, what type of drug you need to prescribe? When you have inflammation, what type of drug you need to prescribe? Inflammation. I'm not asking infection, okay? Inflammation. Corticosteroid, right? So in the same way, when there is a blood clot, when there is a coagulation of blood, we prescribe this type of drug, okay? That is anticoagulant medication. So are you clear? All of you?
Repeat again, ma'am.
Oh, I need to repeat, okay. So when there is a renal vein thrombosis, okay, when thrombosis, any kind of blood clot that occur, okay, it is mainly treated with the help of medication known as anticoagulant medication, okay. This anticoagulant medication, these are the class of drugs. So how this is mainly being given is that it may be given intravenously, okay. There is IV through your vein. It may be given directly through your vein for several days. And then in some cases, it can also be given orally, okay, for a few weeks or months. Means for several days, it is mainly given intravenously, but for few weeks or more, you can just give through orally, okay? Orally. Orally means through mouth.
Okay.
Understand? Understand?
Understand, ma'am.
Okay. All of you, are you clear?
Yes, ma'am.
Yeah, because it's very easy. Renal vein thrombosis means what? There will be blood clot. If blood clot is there, what type of medication you will give? Anticoagulant medication. All this. Write down in a piece of paper very nicely. Infection होने से क्या drug देना चाहिए? Inflammation होने से क्या देना चाहिए? All those things, okay? And when there is a blood clot, what type of drug you need to suggest? When BP is high, what type of drug you need to suggest? All these things now, if you write down in a piece of paper and hang in your wall, you will never get confusions. Okay, you will never have confusion on all these things. So like if there is no one to explain to you, but you find something like that related to anything, it might not be, it might be renal vein thrombosis, it might be renal artery thrombosis, but you have find out now from the name itself, thrombosis, there will be a clot. So from that itself, you can just think, you know, even if other don't tell you the answer also, oh, clot, that means anticoagulant medication need to be given. In that way, you can have idea. So are you clear, right? All of you? All of you, are you clear?
Yes, ma'am.
Okay, response fast, okay?
Yes,
Because me
ma'am.
also, when I never stop. I keep on speaking. So when I ask you, you speak out on the moment itself. The next is the complication of renal vascular disease. Complications. So complications of renal vascular disease. So let us discuss one by one. So if someone have renal vascular disease means all those vascular disease, now the 5 types that we have discussed, that renal artery stenosis, renal artery thrombosis, renal artery aneurysm, atheroembolic renal disease, renal vein thrombosis. Now all those like renal vascular disease, if someone have all this, now all these suffer from all those disease, then what type of complication he or she can have? Okay, that we will be discussed. So the complication include heart disease. So the person might have complication of heart disease, and he or she might have a complication of stroke. All of you know what is stroke? S-T-R-O-K-E. Stroke. To whom will I ask? Bishal, can you hear me, Bishal?
Yes, ma'am.
स्ट्रोक का मतलब क्या है? स्ट्रोक कभी सुना? स्ट्रोक. I'm not asking shock, okay? Stroke. कभी stroke सुना? Bishal? If you don't know, say you don't know. If you know, you respond. I'll just pass the question to someone else. विशाल आइडिया है क्या स्ट्रोक क्या है? Vishal, yes or no? If no, I'll pass someone else.
No, ma'am.
Okay, no problem. Divyaji, can you please tell me what is stroke?
Hello, ma'am.
Okay, rich person,
Hello.
can you tell me what is stroke? Rich person.
Hello. Hello, ma'am.
Yes.
Hello, ma'am.
Yeah,
Paralyzed
yes.
or numbness of
What?
knees,
Oh, you have
numbness
idea.
or paralyzed.
Means like, okay, you have idea, Levin. Okay, thank you. Okay, so stroke means what? Like, how will I explain? Stroke means the stroke, it mainly occur, okay, when when the blood supply to any part of your brain is interrupted or reduced, okay? So in that cases, and in that time, what happens is that all those it will reduce or prevent the brain tissue from getting oxygen and nutrients, all these things, okay? So this, or you can simply write down in bracket if you want to know the meaning. Stroke means a stroke occur when the blood supply to part of your brain is interrupted or reduced, okay? So what happens is that when your blood supply to any part of your brain, means whatever the blood supply that we need to get in our brain, if it is interrupted or else if it is reduced, then what will happen? It will prevent our brain tissue from getting all the oxygen, all the nutrients, isn't it? So that is the reason why because of this interruption and reduce of blood supply to our brain, stroke mainly occur. So you can just write it down according to how you understand. So shall we move on to the next complication?
Yes, ma'am.
Okay. I have explained stroke now. Okay, Srijana, can you please explain what is stroke?
Ma'am, it occurs when there is a reduced blood supply to brain.
Yes. So if there is reduced blood supply to the brain, then what will happen? Your brain tissue will get enough oxygen, nutrient.
No, ma'am.
Okay, so it will obviously when there is like interruption or reduce in the blood supply, your brain tissue will not get enough oxygen and the nutrient. Because of that, stroke mainly occur. Okay, that means all of you are clear. So let's move on. So the next is heart attack. So this heart attack, this complication can also be seen if someone have renal vascular disease. So anyone have any idea? Can you share your idea what is heart attack? Heart attack, anyone? Virginia, would you like to share your this point of view or else your knowledge regarding heart attack, Virginia? Okay, Dibyajit.
Hello, ma'am.
Okay.
Hello.
Baboglang, you have idea? Baboglang? Long jump, you have idea? Malvina? Any idea? Nafisisa?
Ma'am, when there is a circulation problem or when the blood flow to the heart is blocked.
Can you please say again?
When there is a circulation problem in the heart and or when the heart the blood flow to the heart is blocked.
Oh, yes, very good. Okay, Nafisisa, thank you. Okay, all of you, you could hear Nafisisa, right? All of you?
Yes, ma'am.
Okay, it's very simple. Heart attack, we also call it like myocardial infarction. Okay, heart attack, it is also known as like myocardial infarction. It mainly happens is when the blood flow stop, okay, to any part of your heart. When there is a blockage of blood flow, or when the blood flow stop to any part of, to the part of your heart. Understand? In that case, when the blood flow is disrupted, or it is reduced or interrupted, in that case, someone used to have the complication, that is the heart attack. Okay, so let's move on. So the next is heart failure. So heart failure, heart attack, all these like are partially being all related. Okay, all these things. So damage, there will be a damage to the blood vessels, because obviously, because we have studied about renal vascular disease. It's not in some of the vascular disease, there will be like narrowing, atherosclerosis, all those things, and stenosis, thrombosis. Then obviously, if all those happen, then there will be a damage to the blood vessels. So if our blood vessels is damaged, then it can ultimately lead to many health problem, okay, many health issue. So, or it can also damage to any part of your organs. That's why this damage to the blood vessels comes under the complication of renal vascular disease. So are you clear this much point, all of you?
Yes, ma'am.
Yes, ma'am.
Okay. Next, loss
Yes,
of
ma'am.
vision. Okay, there can also be loss of vision. So can anyone tell me what is vitamin A? Vitamin A. What is vitamin A? Anyone? Sujana, please take attendance. Vitamin A, any idea? Darshana, you have any idea about vitamin A?
Vitamin fats.
What? Say loudly. Why your voice is never audible? Say loudly. What is the answer?
Fats, ma'am.
Oh, okay. Vitamin A, whom will I ask? Oh, Senkamchi, can you please tell me what is vitamin A? Senkamchi? Rudolph, tell me what is vitamin A? All these things you already discussed, and so simple things you can't answer, or what is vitamin A? Rudolph, when I ask some question, if you don't know the answer, it's like you all act as if you are not audible, or network, there is a problem in network. So Rashmi, tell me the answer. Rashmi. Rashmi, tell me the answer. I think you have network problem. Okay, Srijana, can you please tell me what is vitamin A?
It is a fat soluble vitamin.
Okay, it is a soluble vitamin. Okay. This vitamin A deficiency can lead to what type of problem? Because you know not the meaning
And
of
night blindness.
yes, very good. Okay, that is what I want to ask. When there is a deficiency of vitamin A ना, हमारा शरीर पे जब vitamin A deficiency हो जाता है, तो then what it can cause? Okay, तो क्या cause हो सकता है? So it can cause to blindness. Okay, night blindness. So that is why this loss of vision. I have mainly this vitamin A topic. It came out because in the complication of renal vascular disease, we could see the loss of vision, right? So that is the meaning of this vitamin A. It can cause night blindness, and this is a fat soluble vitamin. All these simple things. It's not like you have a heart for the first time, all of you. Okay, with this complication, we have come to the end of our this topic, that is renal vascular. disease. So whatever we have discussed till today, all of you, are you clear from the definition till the complication? Anyone want to ask any questions? And I already uploaded all my videos, okay? So like if you have any network issue, you can just listen to it. Are you clear with renal vascular disease topic? All of you?
Yes, ma'am.
Yes, ma'am.
Rasmi, are you clear? Rasmi, are you clear? With renal vascular.
Yes, ma'am. Yes, ma'am.
Okay, Longjam, are you clear?
Yes, ma'am.
Okay, Bhaboklang, are you clear?
Yes, ma'am.
Srijana, are you clear with renal vascular disease topic till definition to complication?
Yes, ma'am.
Okay, Ilasara, are you clear?
Yes, ma'am.
Monica, are you clear? Okay, Finisha,
Yes, ma'am.
Darshana,
Yes, ma'am.
okay, rich person, are you clear?
Yes, ma'am.
Okay, Nafishisa, are you clear? Please respond.
Yes, ma'am.
Okay, Senkamchi, Malvina, Dibyajit, Vishal, Tumpe, Girija, Rudolph, Shelly. Are you clear?
Yes, ma'am.
Oh, okay. Okay, so tomorrow tomorrow is Saturday, right? I have class with you all at 9:15. So, okay. Okay, so tomorrow we will be discussing about this immunization, okay? And then from Monday, we will keep on having the revisions of whatever, like it will be coming in your this final exam, all the importance. We have already completed the revisions, but we'll keep on revising so that you can achieve a good mark now and you can pass out with a good percentage. So Srijana, are you done with attendance?
Yes, ma'am.
Okay, then I will say after this class I will be sending the PDF to you all. Okay, you just see the PDF and you write it down. Don't just download and keep in your this inbox. Okay, you just like write it down. Anytime I can check it. I won't like inform you in advance. Okay, then that's all for today. Okay, thank you everyone.
Thank you, ma'am.
Thank you, ma'am.